Welcome back. It's California Edition. I'm Brad Pomerance. We are joined today by Howard Hyde. He is the president of Southern California Republican Women and Men and the author of this book, Pull the Plug on Obamacare, a citizen's pamphlet. I guess we know your position, but before we talk about this, tell me about the club.
The club?
Yeah.
Well, the Southern California Republican Women and Men, affectionately known as Screw 'em.
I like it. Very good.
Established 1935.
Right.
It's a very dynamic club. We have a great discussion and debate forum every meeting. We meet candidates. They make their pitches. We have a featured speaker. We've had speakers like the chairman of RPLAC, the Republican Party of Los Angeles County,
Fantastic.
Mark Vafiatis. We had Neil Kashkari, the candidate for governor.
How was that?
In July. That was
I haven't met
dynamic.
him yet. I'd like to meet him.
Yeah, so we've had a great lineup of speakers this year.
So let's talk about your book.
Sure.
I think it's interesting and tricky, and I said this to you before. Yeah. It'd be easier to talk about this if it was before implementation.
Well, of course. I mean, that's why I was yelling and screaming about it 5 years ago, before it became law.
Because now the question becomes, if tomorrow Obamacare was repealed, what would happen to those that have received coverage as a result of it, either through exchanges or in the 25 plus states that engaged in the Medicaid expansion?
Okay, well, let's not forget that it was Obama who said, if you like your plan, you can keep your plan. If you like your doctor, you can keep your doctor. And now we find out that that's not true. All those plans, a lot of those 8 million people who were signed up under the exchanges are only there because they got kicked off of their plans that they already had that were good enough as far as they were concerned, but were not good enough as far as the regulations
were concerned. The tricky thing about that idea, and there is no doubt that President Obama had better days than when he made that claim. I mean, there's no question that claim has come back to bite him. But I guess from what I understand, and I'm no expert, believe me, is that those plans were so substandard that they were wound up.
Who's to decide what's substandard?
But it wound up that the government was having to pick up the slack. So, for example, there wasn't coverage for pregnancy, and so a young woman would have a plan, she would get pregnant, and the government will pick it up.
Well, okay, but if you buy a plan, you buy on the free market when there's plenty of competition and lots of providers in the market, you can have a choice between a plan that provides coverage for pregnancy and a plan that doesn't provide for pregnancy. But let's not forget, pregnancy is not a critical catastrophic disease. It's a natural part of human life. And one of the things that we've really messed up this whole debate about is we're not really talking about insurance anymore. Insurance is something that covers you in the event of a catastrophic event that would wipe you out financially. Your house burned down, you get in a traffic accident, something like that. What we're doing with these plans is we're making everything, it's a routine plan of goodies that pays for this and pays for that. And,
but for some people,
we need to get back to the idea of insurance.
Right, but
low premium, high deductible, catastrophic coverage.
So that's fine for those that may be in the middle class, low premium, high deductible. But those that may be lower middle class, lower class, a deductible of any amount is too much, and they can go bankrupt.
Okay, well,
and they do go bankrupt.
They can go bankrupt because they got pregnant?
No, well, they had a pregnancy where the child had complications.
Okay, well, complications, that's different. That's an insurable event.
They got cancer.
Okay, but we've been having this discussion for over 50 years. Okay, Medicaid was supposed to take care of that, but Medicaid has now been demonstrated by studies at the University of Virginia and other places to be no better in terms of actual health outcomes than no insurance at all. So what are we getting for our $400 billion a year?
Well, that's another Medicaid. I mean, it's hard because there's so many elements. There's the exchange, which is one element. There's the Medicaid expansion, which is another element. But here's the challenge: is that we haven't had anyone in Washington talk about repealing Medicaid. So that's really not what's on the table right now.
Okay, but why don't we reform before we expand Medicaid? Why don't we give it a track record of success upon which to build instead of a track record of failure? Well, there are somewhere between 50 and 60 million people on Medicaid, covered by Medicaid
now
today.
More.
Well, right.
Because
it's
of the
going
expansion.
up. Now, Medicaid, think about this. This is, as you say, the poor, the low-income people, people with pre-existing conditions. These are the people that we want to target with this. Are there really 50, 60 more million people who fall into that category? What we should be doing is finding a way to get more people independent so they don't have to depend on the government, rather than expanding the roles of dependency.
And I think most folks, Democrats, Republicans, liberals, conservatives, would agree with that.
I don't know. I don't think Democrats do. Democrats want to ever expand the welfare state until we're all dependent on it.
I think that's a generalization, but what it does appear, though, is that as the law is today, if someone walks into a hospital, the law says you must treat them. If that individual does not have coverage, either through the exchange, privately, or through Medicaid, or through Medicare, you and I pay for it.
The law says doesn't mean that it actually happened. The law also says that veterans, the people who have put their lives and limbs on the line for you and me, should get a certain degree of care through the Veterans Administration system. And instead, what we see is 50,000 veterans over a course of several years requested appointments that were not even given.
The VA is a whole other ball of wax.
No, but we're talking about the competency of the government to say it shall be so, and actually seeing that it happens.
But what's supposed to happen when someone walks into a hospital?
Well, right now, as you said, someone walks into a hospital with a critical condition, they get treated. How that gets paid for afterwards,
Well, right now, you and I pay for it, if they don't have coverage.
Okay, so let's target that group and figure out what to do about it. But I think
that's what the Medicaid expansion was looking to do.
Okay, but let's find the sector of the society and of the economy that is best suited to do that. A bureaucracy in Washington, D.C. is not all-knowing, all-loving, all-powerful to be able to solve everybody's problems. Okay, if you go out and talk to doctors, talk to physicians, go to the conference of the American Association of Physicians and Surgeons, AAPS. I spoke at their conference last year. They tell stories, and in addition to their medical stuff, they tell stories about patients who came in with critical conditions and unable to pay, and they found a way. This is the way it's happening. It's happening in our churches, in our synagogues, in our communities. It's happening out here in America, not in Washington, D.C.
Right,
Washington, D.C. is Medicaid and the VA and the HHS
I don't know
and the IRS.
That we are willing as a society to just hope.
Okay, society and government are not the same thing.
I don't know that we as American people, whatever word you want to use, are willing to say, if someone walks into a hospital and is sick, that we are simply going to hope that that hospital will take them. And if they don't, we're telling that person to walk down the street. Because you think about illnesses that are communicable. I mean, we need them to be taken at a certain level. And so that's why the coverage question becomes critical.
Okay, so let's expand coverage. Let's find a way that more people can get covered. What Obamacare is doing is it's making it more expensive to get covered. And
but not necessarily. I mean,
it's kicking people out of their jobs. We have the worst employment environment in 36 years. There are probably 350,000 jobs have been lost as a direct result of Obamacare's mandates on employers.
I mean,
people who are unemployed can't buy a plan, can't get covered.
There is a question
so you're going to have more people showing up at that emergency room.
There's a question about employer mandates, and that's continued to be postponed. I'm not sure about the studies.
It's postponed, beyond the next election and beyond the next election, so that Obama can give political cover to the vulnerable Democrat senators running for re-election. But it is not postponed in terms of an employer's calculus today. An employer doesn't hire people so that he can fire them next year.
Will you come back a year from now?
Absolutely.
His name is Howard Hyde. He is the author of Pull the Plug on Obamacare. My name is Brad Pomerance. It's California.
The website is hhcapitalism.com.